जन जन में जागे घर घर शाम समूह रे तेरा मंगल मेरा सबका मंगल।
Yes, you are audible.
Okay. A very wonderful good afternoon, Honorable In charge of Institute, Dr. Suryanshi sir, special guest, Dr. Anand More sir, respected Dr. Shekhar Namburi sir, Dr. Priya Thakre madam, Dr. Manisha Tavekar madam, Dr. Prashant Shinde sir, and all presented here. A very amazing welcome to 5th National Webinar on evidence-based approach for prophylaxis and management of COVID-19 through Ayurveda intervention under Azadi Ka Amrut Mahotsav. I, Dr. Vanmala Vakode, Research Officer, shall be your host for the day. Thank you all for joining this last webinar of the series. We should start it. It is a great honor for our webinar to have a special guest, Dr. Anand More sir, Professor and HOD of Rog Nidan and Vikruti Vignan, All India Institute of Ayurveda, New Delhi. We are grateful to you for accepting our invitation and become a special guest of today's webinar. Now, sir is working as professor and HOD of Department Rog Nidan and Vikruti Vignan at All India Institute of Ayurveda, New Delhi. Sir has total 29 years UG and 23 years PG teaching experience. He has been worked as examiner in UG exam since 16th year. He has been selected as examiner in PG exam of different universities like Gujarat, Ayurveda, Jamnagar, RGUGS Karnataka, MUHS Maharashtra, BHU Varanasi, Bharati Vidyapeeth Deemed University. He attended and presented paper in various international and national conference. He worked as a resource person and chairperson at various seminar, conference, webinar and CME. Total 28 students had completed postgraduate course under his guidance. One student had completed PhD and 4 students are going on PhD under his guidance. Sir are life member of National Integrated Medicos Association Pune, NAPAR, India Association for the Study of Traditional Asian Medicine Pune, and All India Ayurveda Specialist Association. Sir are member of editor board, Ayurlog, one Ayurlog peer review journal, second Ayurcare, All India of Ayurveda, New Delhi. He are reviewer in RAHS National Journal, Ayur Journal Jamnagar, PHEA International Journal of Research in Ayurveda, and Allied Sciences also. Welcome sir. So let's, before begin the webinar, I would like to invite in charge of Institute, Dr. Suryanshi sir, to give introductory remarks. Please sir.
थैंक यू वेरी मच डॉक्टर वनमाला जी। इस वेबिनार सीरीज में आप सभी का आज के जो प्रमुख वक्ता हैं डॉक्टर आनंद मोरे जी, इनका हम लोगों को मार्गदर्शन मिलेगा। और ये वेबिनार सीरीज जो हमने शुरू की है, ये आयुष मंत्रालय के तत्वाधान पर इनिशिएटिव ऑफ द मिनिस्ट्री ऑफ आयुष फॉर कोविड-19 प्रोफाइलैक्सिस एंड मैनेजमेंट ऑफ कोविड-19 थ्रू आयुर्वेदा इंटरवेंशन, बेस्ट प्रैक्टिसेस एंड एविडेंस बेस्ड अप्रोच। इस संदर्भ में हमने ये 5 वेबिनार का आयोजन किया गया था 75वें आजादी के वर्षगांठ के उपलक्ष्य में, और इसमें बहुत सारे लोगों को इसका प्रतिसाद भी बहुत अच्छा मिला। हमारे साथ काफी अच्छे वक्ता भी इस कड़ी में जुड़े। आज के प्रमुख वक्ता डॉक्टर आनंद जी मोरे हमको आज मार्गदर्शन करेंगे, और उनका जितना भी अनुभव है कोविड-19 के बारे में और मैनेजमेंट के बारे में, ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा में जो भी वो कार्य कर रहे हैं, उसके सभी प्रतिभागी मुझे लगता है सभी लोग लाभान्वित होंगे और मैं उम्मीद रखता हूं कि उनको सभी को, हम सभी को, आयुर्वेद फ्रेटर्निटी को, आयुर्वेद जगत को इसका लाभ होगा। और हमें इस बात का विश्वास भी होगा कि कोविड-19 जैसे बीमारियों को, जो कि पैंडेमिक का स्वरूप ले चुकी है, उस बीमारी में आयुर्वेद का क्या लाभ हो सकता है, ये जन जन तक पहुंचाने में हम कामयाब होंगे। रही बात सवाल की मिनिस्ट्री ऑफ आयुष ने क्या इनिशिएटिव्स लिए होंगे, इस इनिशिएटिव्स को बताने की कोशिश या जन जन तक पहुंचाने की कोशिश, ये सभी मतलब जितने भी हमारे आयुष के संस्थान हैं उनके माध्यम से हो रहा है। और इसमें खास करके गाइडलाइन एंड पब्लिक हेल्थ एडवाइजरीज हमने पब्लिश की मिनिस्ट्री ऑफ आयुष ने। फिर मोबिलाइजेशन ऑफ ह्यूमन रिसोर्स, मतलब हमारा जो ह्यूमन रिसोर्स है वो कैसे बाकी इसमें काम में आया, हमने कैसा सहभाग दिया, इसके बारे में डिटेल्स में चर्चा की गई या लोगों को हमने बताने की कोशिश की। रिसर्च एंड डेवलपमेंट में हमारी क्या भूमिका रही, इस बारे में हमने विस्तृत जानकारी लोगों के साथ बताई है। और नेशनल क्लिनिकल मैनेजमेंट प्रोटोकॉल जो रिसर्च से संबंधित होगा उसके बारे में हमने चर्चा की। नेशनल वाइड कैंपेन, 2 ड्रग हमारे उभर के आए हैं, ये आयुष 64 और कबासिर कुडिनीर के बारे में हम जन जन तक उसका निःशुल्क वितरण आज भी कर रहे हैं। संसमनी वटी, अश्वगंधा वटी का निःशुल्क वितरण कर रहे हैं। आयुष रक्षा किट का हम वितरण कर रहे हैं और जन जन तक इसकी बड़ी महत्ता और बड़ा पॉपुलर हो रहे हैं ये। तो सब लोग इस बात को मानते हैं और इस बात को जानते हैं कि भाई हमको आयुष रक्षा किट की डिमांड है वो हम लोगों से, उसके पब्लिक की तरफ से मांग आ रही है कि नहीं भाई हम लोगों को आयुष रक्षा किट दीजिएगा। अभी की समस्या जो है कि अभी चौथी वेव जाएंगी, चौथी वेव के लिए आप हम लोगों को दो, और उसकी डिमांड काफी मात्रा में बढ़ रही है, ये हम लोग देख पा रहे हैं। ये सारा जो विचार होगा आज मैं चाहता हूं कि डॉक्टर मनीषा तड़ीकर जी ये डिटेल में हमको बताएंगे और इस मतलब सविस्तर जो मालूमात होगी, जानकारी होंगी, आप तक पहुंचाने की हम कोशिश कर रहे हैं। और पब्लिक हेल्थ में कैसा अवेयरनेस होगा इसकी जानकारी देने के लिए हम प्रयास कर रहे हैं और इसमें हम कामयाब हो रहे हैं। मैं चाहता हूं कि मैं इस वेबिनार के जरिए आप तक जो पहुंचाने का हमारा प्रयास है वो सफल होगा। और मैं बहुत ज़्यादा समय नहीं लेते हुए मैं अभी हमारे जो स्पीकर हैं उनको मैं आमंत्रित करता हूं, उनको स्वागत करता हूं। और ये मेरा सौभाग्य है कि उनको मैंने आमंत्रित किया, उन्होंने बहुत अच्छा ये कोविड-19 में कार्य किया है और वो सब तक बताने की कोशिश करेंगे। आज के दोनों जो स्पीकर हैं, मतलब हमारे संस्थान के महोदया डॉक्टर मनीषा जी, ये भी रोग विज्ञान से जुड़ी हैं, डॉक्टर आनंद मोरे भी रोग विज्ञान से जुड़े हैं। तो मुझे लगता है कि आप सभी प्रतिभागियों को जरूर इसका लाभ होगा और जितनी भी आपकी शंकाएं हैं या जो भी आपके प्रश्न होंगे उनको हम सुलझाने की कोशिश करेंगे। आपकी जो भी मतलब शंकाएं होगी या जो भी आपका जानने का प्रयास होगा उसको हम लाभान्वित करने की कोशिश करेंगे। इसी के साथ मैं अभी डॉक्टर वनमाला जी को निवेदन करूंगा कि वो स्पीकर महोदय को आमंत्रित करें और आगे के वेबिनार की दिशा निर्देश जारी करें। धन्यवाद, बहुत बहुत धन्यवाद।
Okay, thank you, sir, for your information. Now I want to call our special guest, Dr. Anand More, sir. Please highlight on overview of COVID-19. Please, sir.
Good afternoon, one and all. Respected Assistant Director Dr. Milind Suryavanshi ji, Dr. Vanmala Pakode ji, Dr. Manisha Talekar ji, other medical fraternity, and all the faculty and students who have joined this webinar, which is arranged by the RARI Nagpur. And it is my pleasure to join with you on this occasion to interact on the COVID-19. So first of all, I am very much thankful to Dr. Milind Suryavanshi ji and Dr. Vanmala Pakode ji for inviting me here to interact on the topic COVID-19. As yesterday on the 22nd March, it completed 2 years, which is in 2020, Prime Minister Modi ji has been declared that तालियां बजाने के लिए या घंटा नाद के लिए जो उन्होंने हमें बताया गया था, तो इसे 2 साल हो गए और we are suffering from this COVID-19 since last 2 years. So everybody is aware regarding this COVID-19. What is COVID-19? What are the futuristic signs and symptoms, and what will be the future of this COVID-19 on the world or cosmos, and how to prevent it, and what will be the role of Ayurveda in the prohibition of this COVID-19. That is the most important thing regarding the Ayurveda faculty. So introduction, as you know that this is COVID-19, why it is called COVID-19, as this is a coronavirus disease and which is discovered in the 2019, therefore it is called as COVID-19. And this pandemic started since last 2 years back, since January 2020 in India. And its origin is from the Wuhan, China. It started in the late 2019, and after that, its outbreak was spread all over the countries through these international tourists or the persons which are traveling through country to country, and therefore it causes the pandemics, and it turns into the very historical pandemics, that is COVID-19 starts in the 2020. This virus is a very from a large family of virus which causes mild to moderate upper respiratory tract illnesses like the common cold, shortness of breath. But this virus outbreaks from the animal reservoir to cause global transmission concern. Mainly this virus resides in the animals, and through this animal it transferred into the human beings. This virus has been consist of 7 types. Among them, the 4 are very mild, and the rest 3 may causes serious outcomes in the peoples. And this virus infections is observed since 2002 with the name SARS, severe acute respiratory syndrome, which is emerged in the late 2002 and disappeared by 2004. It was appeared in 2002, but later on it disappeared, and again this virus causes MERS in 2012, and it remains in the circulation in the camels, and COVID-19 which is emerged in the 2019. So this virus get dispersed for a short while, and then again whenever he get the chance to react with the community, it comes in the picture and it produces the different types of diseases. In 2019, it comes through this COVID-19, which affected the whole world. And since then, until now, this world is suffering from this COVID-19. But now people has been learned from this COVID-19 how to survive with this COVID-19 or how to live with this COVID-19. Because we cannot avoid that COVID-19, but we have to live with that COVID-19. But while living with this COVID-19, how to live with this COVID-19 and what preventive measures to be taken for the prohibition of the infection of this COVID-19. This is the COVID-19 timeline. This started from the 31st December 2019. China alerted WHO as they have observed the several cases of pneumonia with no known cause in Wuhan, and it was caused due to the COVID-19 virus. Then later on, on 7 January, WHO official announces a virus named SARS-CoV-2 that causes COVID-19. It belongs to the coronavirus family, which includes viruses that causes SARS, MERS, and the common cold. Then later on, 11 January, China announces the first death linked to the COVID-19. And on 13 January, who reported the first case outside of China in Thailand. And after 26 February, 29 February, 11th March, the frequency and the intensity of this COVID-19 get increased. And in 2 April, confirmed cases of COVID-19 tops 1 million worldwide. And on 10th April, global death due to the COVID-19 tops to the 1 lakh. So this was the timeline which we have observed already in the past 2 years. I am just refreshing this timeline with you. As we know, this COVID-19 virus spreads by 2 methods, either direct method or indirect method. Direct method, if person who is suffering from this COVID-19, if sneezes or coughs, that virus comes inside and that get affect to the person in front of him, that is through direct contact, and indirect contact by touching surface or nose or mouth. Whenever this type of infected persons cough or sneezes, this virus may remain on the surfaces, and if we touch the surfaces, that virus get attached to the hands, and if we touch our nose or mouth, then that virus may get entered in the body and may causes the COVID-19. And that's why in preventive measure we have been learned to wash the hand frequently, continuously with soap or any other disinfectant. These are the stage-wise signs and symptoms. If we look over these signs and symptoms of this COVID-19, it can be correlated with the Sanipathic Jwar and Prano-Srota Dushti Lakshan. You can see the stage-wise, that is stage 1, stage 2, and stage 3. That is mostly observed in the mild, moderate, and severe conditions. Usually, it represents with the symptoms like fever, cough, and myalgia. And these type of symptoms can be occurred in the Sanipathic Jwar also. Sanipathic Jwar, we already know what is Sanipathic Jwar. It is one of the type of the Jwar, and 3 doshas get involved in the samprapti of this Jwar. And we can see the Jwar, Kas, and Angamarda symptoms of Sanipathic Jwara in stage 1. And along with that, Prano-Srota Dushti Lakshana, that is Pratishay and Kas. In stage 2, we may get the pneumonia, shortness of breath, and sputum production or cough with expectorant. Same the symptoms may occur in the later on stages of the Sanipathic Jwara, that is Shwas, Kas, Raktapitta, Kapnishtivan. And in Prano-Srota Dushti Lakshana, Sasyabda, Sashul, Uchvas, and Proshana. And stage 3, which is usually occur in the severity cases, that is respiratory failure, septic shock, and multi-organ failure. And in Sanipathic Jwara, it is observed in the form of Jwar and Dhatupak. We know all Dhatupak. What is Dhatupak? Doshpak and Dhatupak. Dhatupak is a condition in which the samprapti get deteriorated in the body and different organs, or there is a pachwan of the organs or dhatu, due to which that samprapti get deteriorated and the disease get to the non-curable or asadhya avastha. So these symptoms can be compared with this sanipathic jwara avastha. And again, sanipathic jwar, which is described as a asadhya avastha in later stage. So we can study this COVID-19 with keeping in mind the sanipathic jwara avastha at different stages. Now with these pandemics, what has been happened to the society or community? There's a lot of effect of these pandemics, which cause a very bad impact on the society, on the different community or different parts, sections of the community. As on 11 March 2020, the World Health Organization declared the outbreak as a pandemic on this COVID-19 has resulted in severe morbidity and mortality, which badly affected the global economy and caused loss of employment to millions of people. Due to this lockdown, the private sectors and all the offices has been shut down, and therefore many workers or skillful workers get migrated to their native places, and therefore it causes a very great loss for the economy, and that employment skillful employees go to their native places, which is causes a very ill effect on the society. This present pandemics of COVID-19 has brought the human activity to stand still and has forced the entire world to seek very seriously for its what are the causes of this pandemic, what are the mechanism of pathogenesis, and what are the solution. As this COVID-19's lockdown is declared there, we were very much curious about this COVID-19. Everybody was curious at that time in 2020. What is the cause of this disease? What are the nature of the disease? How get it transmitted? What are the pathogenesis and what are the probable solution? Everybody was discussing and everybody was searching on the internet or all the present material, educational material, to see all the mechanism of pathogenesis and the solution. As you might be heard or you might have been seen that in first wave, even though in second wave, there were no permanent solution till date, even though till date, there is no permanent solution or there is no stereotype treatment for this COVID-19. But everybody was doing the trial and error for this to resolve the problem. But various trial and errors and various drugs has been employed. But some patients were getting the results and some were not getting the results. They might have lost their leads to the cause of death. So we will see that what are the causes, what are the mechanism of pathogenesis, and what are the solutions. You can see this impact of pandemics or lockdown. All these migrant workers were moving to their cities or native places. They were not getting the bus service or communicating services, even though went by walking at their native places with their families. These pandemics and outbreaks, these pandemics can be described in three forms, that is epidemics, endemics, and pandemics. This epidemics is a sudden spread of the disease within a short period to a large number of people in a given population. We have seen in January 2020 as it starts from Wuhan and it spreads all over the world through this very fast nature for the spread or outbreak. And even though in India also since March 2020, we were observed that there were so many cases were suffering from this type of COVID-19. But at that time, we were not aware about the disease, and therefore everybody was feared due to these diseases, and everybody was very much curious and cautious also to know how this disease get progressed, or how this disease get spread or outbreak, and what is the nature of this disease. India came across a variety of pandemics and epidemics like influenza, cholera, dengue, smallpox, plague, and many more. All these were the threat to the community. As we have previously seen many pandemics and epidemics, and even in worldwide also there is the Great London Plague, which is caused due to the Yersinia pestis, which is recorded 68,500 deaths in 1966. And another are the examples of the cholera, smallpox, plague, and influenza, which is get widely rapid spread of disease as decimated population many times over the ages. COVID-19, a virus of corona family all over the globe, records approximately 350,000 deaths in 20 and 2021. Now, while looking towards this COVID-19, what will be the role of Ayurveda, and is there any description of this COVID-19 in Ayurveda, or can we study this COVID-19 in the fundamental principles of this Ayurveda? So, if you look in the ancient Samhita, that is Charak Samhita, Sushruta Samhita, we may get the different types of references regarding these pandemics. We'll get the reference of Janapadadans Vyadhi in the Charak Vimanstan 3, and we also get the example of Upsargika Rog in Sushruta Samhita, that is communicable diseases. So our acharyas will also very aware about this type of conditions or this type of pandemics, but they have written in the different form or different concepts, because at that time there were no facilities or technology available to sort out the cause of the disease, but they were aware regarding there were some bacteria, some viruses which are existing in the atmosphere and which causes different types of diseases, and this type of disease may cause the community spread and large population death in the form of this Janapadadans Rog and Upsargika Rog. Again, we may get some different references regarding this type of Janapadadans or pandemics. That is Upasarga iti Upasrujata iti Upasarga Pidita Jana Samip Uttaparna Joradaya संसर्गज इति देवादि द्रोह जन संपर्कजा इत्यर्थ, जन संपर्क में आने के कारण होने वाले लोग जो व्याधि है उसे संसर्गज व्याधि कहा जाता है. आगंतुज व्याधि, this type of आगंतुज व्याधि which is caused due to the external factors without any involvement of Vatadi dosha initially, because this type of diseases caused due to the agantur bhuta visha vayavagni sampraharadi samuttaha. So agantu, that is external cause, bhut, vish, vayu, agni, sampraharadi, samuttaha. So this type of agantuj vyadhi which causes due to the external factors, and on later stage it shows the involvement of the vatadi dosh. This type of diseases are called as agantuj vyadhi. So what are the references of pandemics in Ayurveda? So references of pandemics and epidemic diseases are mentioned in the form of this Janapadadons Vyadhi, Upsargic Vyadhi, Marak and Krumi Rog. Krumi Rog also described very elaborately in the Ayurveda, but as good as the references of Krumi we get in the from the Vedic period. In Atharvaved, we get the very various references of these Krumis which cause the different types of diseases. And again in Ayurveda also, the Krumi Rog chapter is described elaborately and which is causes different types of diseases. These observations, keen observation of acharyas were mentioned in all the Samhitas of ancient era. So Krumi Rog, which is caused due to the either Bahya Krumi or Abhyantara Krumi, and against Abhyantara Krumi, that is Raktaj Krumi, which may causes different types of diseases, in which mainly the Kushta is described. And as we know, the Kushta is caused due to this bacteria, Mycobacterium leprae. So acharyas were knowing that there is the existence of these krumis in the atmosphere, or krumi-like structure in the form of either bacteria in either or fungi, fungal infection also. That is in skin disease, that is Dodru. So these are the references which we come across in the Samhitas. But in spite of that, this COVID-19 can be studied with the help of this Anukta Vyadhi. Anukta Vyadhi की जो योजना बताई है, which are not described in the Samhitas but can be studied on the principles of this Ayurveda. And therefore there is one sutra, that is Vikaranam Kushalo na jiviyat kadachana nahi sarva vikaranam nam tusti dhruva sthiti sayo kupito dosha samutthana vishesha sthanantara gatashaiva janayatyamaya bhun. There is not necessary to know every time the name of the disease, because we cannot give the or nomenclate the disease every time, but sometimes we have to observe the Samprapti Ghatak and Dosha Dosha Samurchana, and on the basis of that we can diagnose that condition, and we can give the treatment on the basis of that Samprapti Ghatak, because the main principle of this Chikitsa is the Samprapti Bhanga. And if we break that Samprapti or that process, that through this treatment, that disease can be break. So it can be studied under the heading of Anukta Vyadhi also. Even though if it is not mentioned in the Ayurvedic Granthas, but it can be studied under the Anukta Vyadhi. But again, these very beautiful examples of this Janapadadons Vyadhi and Upsargic Vyadhi. Under this heading also, we can study this COVID-19 very elaborately. So these are the references of pandemics in the Ayurveda, and these are seen through Janapadadons, Krumi Rog, Marak, and Upsargic Rog. So what are the epidemics? Epidemics is nothing but the which is widespread of the infectious disease in a community at a particular time. This type of infection spreads in the specific community at a particular time, and therefore the group of people can be seen with the symptomatology of that particular disease, that is called as epidemics. Endemics is nothing but the condition regularly found among particular people or in a certain area. And whenever this type of epidemics, endemic starts, it get spread or it get outbreak, and it occupies the whole world. Even though we know that this COVID-19 spread in 134 countries, and that condition is called as pandemic, that epidemic occurring over a wide geographical area worldwide, that is called as pandemics. And it was this condition which was observed in last 2 years, and where the observer of this condition since last 2 years. Janpada Dhams, that is the Nirakti Janapada, are the major realm or republic or kingdom of Vedic India. And Janpada also meaning gathering places of men or merchants. Janpad, it is nothing but the community where living together or gathering place of the various peoples. It's called Janpada. And Janapada Dhums means Janapadanam Udhavansanam Markena Tatra Tayanam Bahunam Manavanam Marnenan Iti Artham. Matlab, the cause which is responsible for the death of the Janapada or many peoples is called as Janapada Dhams Hetu. So which are these Hetu? So they, while describing the Janapada Dhams Vyadhi or Janapada Dhams Rog in Charak Vimansthan 324, Charkacharya has been described two types of main reason. One is the inequality of human composition, and another is the derangement of global indicators such as Vayu, Jal, Desh, and Kal. Dushit Vayu, Dushit Jal, Dushit Desh, and Dushit Kal, which may turn to the pandemics or Janapada Dhams Vyadhi, even though we can see if, this type of epidemics many times in the practice due to contaminated Vayu, contaminated water, contaminated Desh, and that is a particular area, and Kal, that is Parinam, which may result in the epidemics. And this type of epidemics were known since time immemorial, because acharyas were very familiar with this type of causes, and on the basis of these causes, they have described the treatment also, how to treat this type of Janapada Dhams. If we look at this sutra, that is Prasangat Gatra Sparshat Nishwasa Sah Bhojanat, which is described by Susrutacharya, upsargic means which the disease which spreads through these contagious causes or spread by person to person, Prasangat Gatra Sparshat Nishwasa Sah Bhojanat, Sahachayachana Chapi, Vastrmala Nulepanat. If we look these type of factors, which we come across all these factors in these COVID conditions. All these conditions may causes the spread of this virus, and which may turn into the COVID-19. Even though Acharya Susruta were known or familiar with this type of factors which causes this type of obstetric rog, that is Kushta, Jor, Shosh, and Netrabhishanda. Netrabhishanda is nothing but the conjunctivitis, Shosh is the tuberculosis, Jor, that is the epidemics we come across every year, that is influenza, and Kushtam, that is leprosy. So this type of conditions which causes or get spreads due to this type of factors, and this type of diseases are called as upsargic rog. So even though in COVID era, we have seen this type of all the factors which were causes the spread of this COVID-19. If we look at this type of rush or crowd, even this may turns into the major outbreaks for the spread of this COVID-19. And this was the condition during the second lockdown. After first lockdown, there were a little bit liberal conditions, and central government has been instructed to state government regarding the whether they should adapt lockdown or they can give their instruction to the state-wise. And therefore, there were different instruction and regulation state-wise, and which it may turns into the outbreak of this COVID-19. So in Ayurveda, just I told you that this type of symptoms which we come across the Sanipathic Jwara, even though if we see the Jwar, the Pratatmak Lakshan of Jwar is the Santapo Deha Manasa and Vata Kapha Jwar, which are the resemblance of this COVID-19. All these symptoms were observed in the COVID-19 patient in the mild and moderate conditions. In concern to the Vat Kapha Jwara, and then after that, in stage 3 or in severe condition, most of the symptoms were observed in the Sanipathic Jwara. So it can be compared with this Jwara Avastha, that is Vat Kapha Jwar or Sanipathic Jwar and Abhisanga Jwar. Abhisanga Jwar, which is caused due to the external factors. So how this mechanism or pathogenesis takes place in the January 2020 to March 2020, and after that outbreak get exploded, and there were the so number of cases of this COVID-19 seen in the every state, and therefore government had decided to prohibit this type of infection, and there were one solution of that lockdown, and therefore government had declared that lockdown on the 24th March. So this is the chronology of this first wave, which is started since 30th January 2020. That first 3 cases of COVID-19 were identified in Kerala province, and 2nd and 3rd February, 2 patients who returned from Wuhan and China were also came to the India. And 2nd March, 2 other positive cases were identified, and 1 patient had a return from Vienna and other from Dubai. And on 10th March, the total number of positive cases were 50, and the first case death reported on the 12th March, and afterward the COVID-19 spreads in the nation at a very rapid rate. And therefore, after that, government has been declared the lockdown, which was the primary solution for that to prohibit the infection and that control on the crowd. On the basis of this Epidemic Disease Act 1897 and Disaster Management Act 2005, in mid-March, they have declared the lockdown all over the country. As I told you that on the 22nd March, there was a Janta curfew to thank the essential workers by clapping or ringing bells at 5 p.m. We have observed 2 years back. And after that, from 24th March, that government had declared the lockdown involving all the educational institutions, museum, gyms, swimming pool, cultural and social activities, and theaters are closed. And even though traveling, that is air traveling, railway and bus state bus services also get prohibited or it is closed. Even though private sectors also, that companies were closed and they have instructed to work from home for their employees. So during lockdown, so many advisories came from the government, and so many advisories come from WHO also, and we start following that type of advisories in the form of that social distancing, preventive measures related to the historic building. That historic buildings are closed because so many people were visiting that historic buildings, and therefore it may turns to the spread in the COVID-19. Preventive measures in transportation, that is, I just told you that air services, railway and bus services has been abandoned to prohibit this infection. And even though on 16th April, government has been divided these zones in the three category, that is hotspot, orange and green, little to no transmission zone. And according to that, if there is a so many community or persons are suffering from COVID-19, that area was under the red or hotspot, which is containment zone. It was restricted that persons to come that out of that area. So during this lockdown, first lockdown and first wave, Ministry of Health and Family Welfare has closely monitored the situation of COVID-19 outbreak, and its control had become a topmost priority, because government wants its control at any cost, and therefore they have some advice, some preventive and protective measures, which we were adopting that preventive measures since last 2 years. That is, wash hands, maintain social distancing, avoid touching eye, nose, and mouth. And if somebody is suffering from fever, cough, and difficulty in breathing, seek medical care. Or if somebody is ill, they should follow the advice of the doctor, or visit a doctor if feel unwell. So these were the some advisories which were Ministry of Health Ministry of Health and Family Welfare has been suggested during that lockdown. This, if we look grossly at this impact of lockdown, the 2020 lockdown left 10 millions of migrant workers unemployed. Factories and workplaces shut down. Many migrant workers were left with no livelihood. Thus, they divided to walk hundreds of kilometers to go back to their native places, accompanied by their families. And state governments had been set up immediate relief camps for the migrant workers returning to their native states. This we have observed in the first lockdown, that every state government has been set up a relief camp, and they were giving the services to the workers to reach their destination or their native place. At that time, this type of situation was observed on the televisions. It also causes impact on education, economy of the country. Education has been hampered in various ways. Either there may be the cancellation of the examination, or the cancellation of the interviews of this UPSC examination, and CBSE and JEE examination also get cancelled, and all the school and college examinations were either postponed or cancelled due to this gathering, because it was not possible to accommodate all these students at a time, and therefore they have either postponed or cancelled the school examination. And later on, as the government policy, they have been either promoted in the next year class, or they have declared the result on the basis of their annual work progress. The one thing come in practice, that is, many educational institutions adapted to e-learning and remote learning. This is the contribution of this COVID-19 to all the community to interact through this e-learning and remote learning facility, and therefore webinar and all these webinars come in practice through these e-learning facilities. There was a great impact on the economy also, that Sensex collapsed first time after 2017, and even though it causes the crash down of the Indian stock markets also, and its impact on the power demand, labor participation, and railway freights traffic fell affected. Even though government has been banned on the social media also, because through this social media, Facebook, Instagram, and Twitter, people were circulating the fake news and that misinformation regarding the government policies or this type of diseases, which may produces the fear or induces panic conditions in the public community, and therefore they have been banned on the this social media also. And there is a major blow on the healthcare workers, because in the first wave, everybody was not aware regarding this disease, and everybody was very fear of this disease, and therefore we don't know how to accommodate with this disease and how to serve the patients in the wards. And in that condition, Indian Medical Association has been announced that 198 doctors had been died due to the COVID-19 in first surge, and after that, even that number got increased into June 2021, and it reached up to that 515 and later on 734. So it also causes the major blow to the healthcare workers, because our healthcare workers also were unknown regarding the how to behave in the ward or how to behave in the ICU, how to wear the PP kit. All these conditions were not very familiar to the healthcare workers also, and therefore this type of blow was observed. These are the impact on the religions. That is, many religious programs has been either cancelled or it was celebrated in the closed rooms or in the home only. Even though Char Dham Yatra was conducted in a controlled manner, and as the use of technology, many religious institutions adapted and connected to their devotees through via live streaming and radio and television, which we have seen since last 2 years. But some super spreader events was taken place in between this. One was in Delhi and another was in Haridwar. And this type of functions or this type of events which causes the major spread of this COVID-19, there at after Kumbh Mela, it took 1800 percentage increase in COVID-19 transmission during that period. So we should have avoid this type of events, even though that the condition of this COVID today is very lightly, but we should avoid this type of events at personal and social level also. Government has taken the help of military services for the control over the mob, and even though private sectors businessmen have been helped to the governments in this very critical condition, India had been provided the 65.5 million doses of COVID vaccine to the 95 countries between 20 January 2021 and late March 2021. And even though other international countries also helped to the India in the form of either oxygen production units or the PPE kits and other required items which were supplied by the other friend countries to the India. In spite of this first wave, there were some challenges remain as it is, because despite of this decision and measure, there were many challenges in way for India to confront and defeat the outbreak of COVID-19, including the following. There were the majority of the hospitals in India have been overburdened, or understaffed and poorly equipped. As we have seen in first wave, there were very dreadful fear in the community, and therefore if somebody get infected, he tried to get admitted, and therefore all the hospitals were full. There were no beds in the hospital, and if due to this heavy load of the patient, there were all the healthcare workers were overburdened, and there is a lack of staffs in the hospital also. And primarily at that time, we don't have that much number of ventilators, and therefore we don't have that much equipment to provide the facility to all the persons. And therefore government has been ordered to the BHEL to provide the ventilators, and they have provided 50,000 ventilators for the government services. So what lessons should we learn from the first wave? That experts were predicted that the second wave will be even more dangerous than the first. Therefore, any lesson learned from the first wave of COVID-19 will be helpful to control the spread of the virus, such as increase in testing. In first wave, there was the number of tests were very less. Therefore, the number of the patients were seen very less. Increasing the supply of PPE and other medical supplies. Even though in first surge, all the equipments were on a very less quantities, and therefore in second wave we have adapted all these lessons from the first wave, and we get equipped with all these facilities. And following COVID, appropriate precautions such as wearing masks, avoiding gatherings, following hand hygiene, and maintaining a social distancing of at least 2 yards. Considering that India needs to accelerate its vaccination campaigning against COVID-19. First wave, there was no vaccination, and therefore India started concentrated on the production of the vaccine, and 2 companies have been produced that vaccine in the form of either Covishield and Covaxin. And in the second wave, at the start of the second wave, there was a availability of the vaccine in the market, and they have started given this vaccine to the healthcare workers and frontline workers. So if we compare this first and second wave of the COVID-19 in India, we can compare this. In first wave, the organism was the SARS-CoV-2 virus, but as there was a mutation of these viruses, in second wave, there were different viruses, that is Delta Micron virus was present in the second wave, which is blamed that due to the Delta virus, that number of the spread has been increased. In first wave, how much we were knowing about the disease? We were knowing very less information about the disease, but as time passes, we have learned, and we have adapted many more information from the media, international stage, and up to the second wave, we were very much familiar, and we know very much regarding this disease. Symptomatology in first wave, there was a more related to the respiratory system, but surprisingly in second wave, there is the involvement of digestive system also. That is, there was a loose motions and vomiting. This type of symptoms have been added in the patients. Presentation in first wave, there were very the presentation was more severe, but in second wave, it is lesser intense. As I told you that in first wave, nobody was knowing regarding the treatment part of this disease. So in first wave, mostly modern medicines, they have tried on the basis of trial and error, and they have tried very different and various drugs to combat with this condition. And sometimes it works, sometimes it doesn't work, and therefore it causes severe effect in some cases. As in first wave, it was involved only respiratory system, therefore less cases with breathlessness. But in second wave, this Delta Micron causes the more impact on the respiratory system, and which causes that breathlessness, and people also very much under pressure that if somebody get infected, it immediately run to the hospital to get admitted. If some complications may develop, therefore that patients may get was getting admitted in the hospital. In first wave, mostly the older population was get affected, but in second wave, there were no any discrepancy, and the more younger population was also get affected. Comorbidities, patient with comorbidity affected more. In second wave, it was less. Drug availability in first wave, as I told you, that there was an acute shortage, and there will black marketing also of this drug, antiviral drugs. And in second wave, as the government has been provided or procured this medicine, and therefore these medicines were available in all the hospitals and the pharmacies. Healthcare, what was the condition of the healthcare workers? In first surge, they were less trained people and fear of acquiring infection and not vaccinated. But in second wave, they get trained due to the first wave, and that also the fear of was get diminished. And in second wave, the vaccination was given to the healthcare workers and frontline workers. In first wave, there was a higher rate of the death, and in second wave, the death rate is slow. Positivity rate was lower. It may be due to either there were less testing, and in second wave, there was a high number of this. As availability of the bed, in first wave, it was a limited beds. In second wave, it was enhanced. Ventilators were less in the first wave, but it was increased to the 50,000. Primarily at first wave, the only one laboratory was testing the samples, but in second wave, many private laboratories were involved in the testing facility. In first wave, the vaccine was not available, but in second wave, 3 approved vaccines get available. That is Covishield, Covaxin, and Sputnik. So these are the major differences of this first and second wave. In particular, India's first wave of SARS-CoV-2 infection began in late January 2020 and lasted for about 9 months. and total of 11 million cases and 0.157 cases deaths were reported from India over this period, with a peak attained in mid-September 2020.
Sorry for interruption. I have a problem of internet for the system. So I am joining with this mobile. Kindly bear with me. I will only talk with verbally because I can't share the slides through mobile.
Okay, no issue, sir.
So after this second surge, there is some super spreader during this second wave, and that super spreader where it may be in the form of either due to some crowded events which was arranged during this second surge, and therefore government was also very under political pressure to avoid this similar restriction when cases start rising again in April. So central government has been taken the decision, and they have left it to the state government to take the decision regarding lockdown, and it is kept on the state's policy whether they can adopt the lockdown or they can give some restriction to the people community. So after that, vaccination strategy started. Vaccines has been invented in the second wave, and in phase 1, after 16 January 2021, the healthcare workers and frontline workers have been vaccinated. The 20 millions vaccinated frontline workers. In phase 2, which is begun on 1st March 2021 to cover 45 plus years old with comorbidities and 60 plus year old frontline workers received at least 1 dose. And at phase 3, vaccination campaign was open up to the include all eligible adults 18 plus from 1st May 2021, following a surge in cases in April. And up to 22nd October 2021, India delivered 1 billion doses for COVID-19, out of which 700 million were single doses and 300 million were double doses. After that, third wave has been started, which is with the new virus, that is Omicron virus. But luckily, through this virus, there were no very serious effect on the community. There were positive cases in the society, but its effect was very less and in the form of milder form. So due to this Omicron virus, there were minor infections, that is URTI or flu-like symptoms, which was observing in the patients, and there were no hospitalization required. Only the symptomatic treatment of that crocin paracetamol was advised by the modern medicine. Unsymptomatic treatment was advised for this third wave. But with the symptomatic treatment, 3 key factors have been adopted. that is individual behavior and social factor, that is crowding, use of mask and physical distancing during the social interaction was adopted. Another is the health system. Health system, especially in the Maharashtra, northeastern state of India, instituted early lockdown in response to the second wave, even before attainment of its peak. And third one is the biological factors. In addition to viral transmission, immunity to SARS-CoV-2 raises several important considerations. So these were the three waves which we came across in these last 2 years. And we have observed many of us were positive during these three waves. And surprisingly, we are in now better condition. But what was the role of Ayurveda? Modern medicine has been trialed so many drugs. I told you that in first wave they have tried hydroxychloroquine, plasma therapy, flavivirir, tocilizumab, or deoxy-D-glucose, and ivermectin. All these drugs were prescribed to the patients in the first wave, but again they were treated like a trial and error method, because some of them were getting relief, some of them were getting worse condition, and therefore it was going on. At that time, Ayurveda has been introduced some major advisory from Ministry of Ayush in the form of Ayuraksha kit. I will come later on at that point. In second wave, injection remdesivir was giving, and steroid was giving to the patients. And as I told you that in third wave, they were giving the tablet Dolo or paracetamol, Procin, and antihistaminic and anti-expectorant. All these modern medicines were giving routinely, but many of the patients were getting results, many of the patients were getting divorce, and some of have they lost their life also. And at that time, Ayurveda has been introduced, and Ayurveda has been taken that opportunity to introduce their immunomodulator, immunobooster drugs in that COVID-19. As in Ayurveda, there is three type of treatment: all this type of treatment has been adopted to treat this COVID-19. Daiva Pasre, that is Home Havan, Niyam, Mantra, Dhupan, Manimangal, Prayashitta, Upvas, Swastayan. Among them, Home and Havan was doing regularly. In All India Institute of Ayurveda, Home and Havan was doing daily at the Dhanvantari Vatika Mandir, and that Dhupan was circulating in the hospital and in academic block. As its importance has been described in the ancient Samhitas also, that Dhupan is important to kill the organism in the atmosphere, and therefore we have been adapted that Home and Havan daily, regularly in All India Institute of Ayurveda. This Dhupan was doing with the help of this Gomai, Vacha, Gruta, Neem Patra, Tulsi, and other Dhupan Yog for this Havan. As this was the Daiva Pasre Chikitsa, another is the Yukti Pasre Chikitsa. It is done with the help of these different types of Aushadhi Dravya. But I told you that there were no any drug has specific claim that to treat COVID-19. Therefore, exploration of traditional remedies are highly needed in current scenario, and that exploration has been done in this COVID era very efficiently and effectively by fraternity. Mostly it was kept in mind to treat this COVID-19 with ज्वर चिकित्सा, that is लंघनम स्वेदनम काले योगस तिक्तोगरसा पाचनन्य उपकवनम दोषानम तरुणेजोरा. तिक्तरस वाले द्रव्य जो है, that is गुडुची, was important, and that Sanshomani Vati was used in Ayurveda kit. Just Suryavanshi sir has been described that CCRS and Ministry of ICE is distributing this Ayurveda kit to all the peoples. Among that Ayurveda kit, the main drug is the Sanshomani Vati, Ayush Kada, Anutail, and the Chyawanprash. This Guduchi is basically Tiktarasatmak Dravya, and it also used as a Joragna. It is also immunomodulator. So it has a multidimensional effect, and therefore it was very much useful to treat this COVID-19. You can use the Shadanga Paniyam, Mustaprapatak, Ushira Chandana, Udicha Nagare, Shrutam Shitam Jalam Dadyat Pipasa Jora Shante. So Shadang Paniya bhi de sakte hain. We were advised to take the Ushna Jal throughout this COVID era to the patient, as we know the importance of the Ushna Jal, and we know the Gundharma of Ushna Jal, as this is a Pachanam या जोर में या वात अनुलोमन करने वाला है, अग्नि प्रदीपन करने वाला है. तो we have prescribed the Ushna gel for the drinking water. And among the drugs, just I told you that Ayurveda kit, as good as there are various single herbal drugs which can be acted as a immunobooster, and they have abundantly used in the treatment of this COVID-19 patients. Among them, that Giloy, that is Guduchi, Ashwagandha, Amalki, Tulsi, Dhanyak, Rosan, Kshirpak, Haridra. That is the Ministry of ICE has been advised the golden milk, that is milk and Haridra, Marich, Kantakari, Vasa, Nimba, Pippali, Sunti, Brahmi, Tuak, and St. Madhu. These all drugs are act through the Vatkaphar in nature and antioxidants, anti-inflammatory, immunomodulatory, and antimicrobial. So we should treat it as a Vatkaphar Joragna Chikitsa and Sanipathic Jor Chikitsa. For Jwara, we have given various patients and various drugs, including Sanshomani Vati, Mahasudarshan Ganavati, Ayush 64, Lakshmi Vilas Ras, Jai Mangal Ras, Amruta Arista, and Shadanga Paniya. We have also used new Ayush 64, Sanshomani Vati, Amruta Arista, and Mahasudarshan Ganavati in abundant patient, and we have very interesting results in all the patients. Even we have given Nima Ghanavati also. And for Kasa Chikitsa, we have given Vasa plus Kantakari, Talisadi Churna, Khadiradi Vatti, Lavangadi Vatti, Vasavle, and Ayush Kada. In first wave, there was a cough and a fever and throat pain to the patient. So this type of treatment was giving to the patient. If there is a breathlessness, we were giving Pushkarmul, Bharangi, Vagri Haritaki, Guduchi, Nagar, Kankasav, Lakshmi Vilas Ras, Mahaya Lakshmi Vilas Ras. This medicine was added if there was a breathlessness to the patient. For Kantashul, there was a gargling of the Triphala powder with Koshna gel, and milk and turmeric powder was giving for the Kantashul. For Agnideepan, Ayush Kada and Rasayan Karma, Chavanprash, Agastya Hridaki and Amalki Rasayan was giving to the patient. So, in spite of that, there were the two projects where were going. One of them is completed, that is Ashwagandha. Ashwagandha and HCQ comparative study was done in the patients, and among them we have very good results for the Ashwagandha tablet also. And another one project going on of CCRS. Another one project is also going, that is Ashwagandha and Covishield vaccine. Ashwagandha is given to the volunteers of Covishield vaccine, and what is the result or effect of this Ashwagandha who are taking this Covishield vaccine is that study is going on till date. In spite of that, various research projects are going on under the Ministry of Ayush, which will be helpful in future. But if we see overall, there are many projects through which new medications has been proved and very effective in the COVID-19. And these are the various drugs which were using routinely since last 2 years. If we give the examples of Ayush Kada and Ayurveda kit, in Delhi we have given this Ayurveda kit to the 80,000 police personnel 3 times, and surprisingly and luckily we have got very nice results of this Ayurveda kits. In many of the police, they were safe during this consuming that Ayurveda kit, and whatever they have affected in some percentage, they have very less symptom or mild symptoms in that cases. So these are the various treatment protocols in the Ayurveda. And for preventive measure, we have to adopt Dinacharya, Rutucharya, yoga, and Sattva-Vijaya Chikitsa, that is avoid Hitkar, Manonigraha, spiritual aspects of Ayurveda for communicable disease against reflect through the Sattva-Vijaya Chikitsa. And we have to adopt the Achar Rasayan. And there are many Ayurvedic drugs which can be used or which can be utilized for the immunomodulatory and antiviral property. So this will be a milestone in the prevention and control of COVID-19. And finally, while concluding that we should keep the holistic approach for this COVID-19 for treatment. That is, we have to adopt the Dinacharya and Rutucharya, which is described in the Ayurveda. Importance of diet for immunity, Vyayam, indoor and outdoor exercises, useful Upakram, that is therapies, for symptomatic management, Ayurvedic herbs, drugs and formulation, immunoboosting Chikitsa, yoga practices and spiritual aspects, and Dupan therapy, Ayurvedic hand sanitizer and nasal spray with useful drugs. Even we have to follow the guidelines which is given by the Ministry of Ayush. That everybody knows that guidelines. So through this line of treatment, we can cure the COVID-19 cases, and we have done it very effectively in these 3 waves: first wave, second wave, and third wave. And until today, there are very less percentage of these cases observed in the Delhi. of the third wave. So let's hope for Ayurvedic drugs which are very useful for treating this COVID-19. So this was my presentation of today. I am very much thankful to Suranshi sir, Vanmala madam, and other faculties for giving me a chance to interact with you on this webinar. Thank you very much.
Thank you, More sir. Thank you very much. Dr. Vanmala ji, kindly.
I'm very much sorry for that there is a lack of internet in the medium, so I have to take it on mobile mode.
Thank you, sir. Thank you so much, sir, for extremely information session. As you say, the impact of pandemic COVID-19 is observed in every sector around the world. But positive thing that digital technologies were adopted to deliver webinar, workshop, online classes also. So without consuming any time, let me call on Dr. Manisha Talekar, madam, research officer, to start a detailed presentation. Please, madam.
Good evening to all. I am Dr. Manisha Talekar, working as a research officer at Regional Ayurveda Research Institute, Nagpur. Before starting my presentation, I would like to thank our in-charge sir, Dr. Suryavanshi sir, our guest speaker, Professor Anand More sir, my senior colleagues and all the listeners.
Manisha.
Yes. Am I audible?
Yes, yes.
Today, my presentation is on initiatives of Ministry of Ayush. For COVID-19 and prophylaxis and management of COVID-19 through Ayurveda intervention, best practices and evidence-based approach. All of you know that Ministry of Ayush has been taken various initiatives during COVID-19 pandemic since March 2020 and published various guidelines and public health advisories. They also utilize the Ayush infrastructure and human resources. They develop the various research and development plans, produce the National Clinical Management Protocol. They launched the nationwide campaign for Ayush 64 and Kabasura Kudinirkwar. They also disseminated the research outcome in the form of the article and published the article in reputed journals. Public health advisories. आप सभी को पता होगा since March 2020 से मंत्रालय ने रोग प्रतिरोधक क्षमता बढ़ाने के लिए जन साधारण हेतु विभिन्न दिशा निर्देश और सुलभ घरेलू उपाय यानी उपचार की सलाह समय समय पर जारी की है। सामान्य रूप से रोग प्रतिरोधक क्षमता बढ़ाने के साथ साथ इस दिशा निर्देशों में विशेषतः श्वसन संस्थान संबंधी उपायों पर विशेष बल दिया है, जिसमें जो आयुष मंत्रालय ने गाइडलाइन पब्लिश की थी उसमें बताया था कि जैसे गर्म पानी पीना है, योगासन, प्राणायाम करना है, मेडिटेशन करना है एटलीस्ट 30 मिनट्स, घरेलू जो यूज होते हैं स्पाइसेस जैसे हल्दी, जीरा, धनिया, लहसुन, इनका ज्यादा मात्रा में जो है उपयोग करना है। सिंपल आयुर्वेदिक प्रोसीजर है जैसे प्रतिमर्श नस्य का उपयोग बताया था तिल तेल या कोकोनट ऑयल या घी से। उसके बाद कवल बताया था यानी कोकोनट ऑयल या तिल तेल का जो है 1 चम्मच जो है मुंह में उसको रख के उसका कवल करना है। च्यवनप्राश लेने को बताया था, हल्दी वाला दूध पीने को बताया था। यानी ऐसे कुछ घरेलू उपाय जो है मिनिस्ट्री ऑफ आयुष ने जो है हमें बताए थे और इसका प्रचार प्रसार भी जो है विभिन्न सोशल मीडिया प्लेटफॉर्म तथा प्रिंट मीडिया के माध्यम से जनसाधारण के बीच प्रसारित किया गया है। Then guidelines related to COVID-19, practitioner guidelines for COVID-19 management, general guidelines for clinical research, specific guidelines for clinical studies on COVID-19, then telemedicine guidelines for Ayush practitioner, guidelines for practitioner for COVID-19, yoga protocol for psychosocial rehabilitation, then home care guidelines for children, and advisory on Ayush intervention for prophylaxis and management of COVID-19. Utilization of human infrastructure, Ayush infrastructure and human resources. Ministry of Ayush has been extended support to Ministry of Health and Family Welfare for the utilization of Ayush infrastructure and human resources. They communicated to all Ayurveda, Siddha, Unani and Homeopathy university and colleges for utilization of the available infrastructure. जब कोविड-19 पैंडेमिक स्टार्ट हुआ था तब वेरियस आयुष इंस्टीट्यूशन में जगह जगह पे क्वारंटाइन, आइसोलेशन और कोविड केयर सेंटर्स एस्टेब्लिश हुए थे। लगभग जो है 8 लाख जो आयुष स्टाफ जो है कोविड वॉरियर के रूप में रजिस्टर हुआ है और कोविड वॉरियर पोर्टल में इसकी जानकारी जो है अवेलेबल है। अप्रोक्सीमेटली 1 लाख से ऊपर आयुष मैन पावर जो है उनको प्रशिक्षण दिया हुआ है थ्रू इंटीग्रेटेड गवर्नमेंट ऑनलाइन ट्रेनिंग और अप्रोक्सीमेटली 28,473 आयुष मैन पावर जो है कोविड-19 रिलेटेड हेल्थ केयर सर्विसेज के लिए डिप्लॉय हो चुका था। Then Ayush facilities as a COVID care center with Ayush human resources have been successfully implemented at various Ayush institutions. यानी ऑल इंडिया इंस्टीट्यूशन ऑफ आयुर्वेदा दिल्ली कोविड केयर सेंटर हुआ था। नेशनल इंस्टीट्यूट ऑफ आयुर्वेदा जयपुर में भी गवर्नमेंट ऑफ राजस्थान ने परमिशन दी है 50 बेडेड कोविड केयर सेंटर की। तमिलनाडु में नेशनल इंस्टीट्यूट ऑफ जो सिद्धा है वो भी कन्वर्ट हो चुका है कोविड केयर सेंटर में। दिल्ली का चौधरी ब्रह्म प्रकाश इंस्टीट्यूट और तिबिया कॉलेज और धन्वंतरी आयुर्वेदिक कॉलेज चंडीगढ़ में भी जो है कोविड-19 के जो पेशेंट्स है वो अच्छी तरीके से मैनेज हो रहे हैं यूजिंग आयुष ह्यूमन रिसोर्सेज एंड आयुष फैसिलिटी। देन आयुष कोविड-19 काउंसलिंग हेल्पलाइन नंबर जो टोल फ्री नंबर है 14443 वो भी जो है मिनिस्ट्री ऑफ आयुष ने जारी किया है, जिस पर आयुष चिकित्सक तथा वैज्ञानिकों की जो टीम है वो सुबह 6 बजे से लेकर रात के 12 बजे तक कोविड-19 के जो मरीज है उनको फोन पर स्वास्थ्य संबंधी सुझाव देते हैं। Then impact assessment of effectiveness, acceptance and usage of Ayush advisories and measures in the prevention of COVID-19. आयुष मंत्रालय ने पिछले साल जनसाधारण द्वारा आयुष दिशा निर्देशों को जो एडवाइजरीज आयुष मंत्रालय ने लॉन्च की थी उनका उपयोग करने तथा कोविड-19 की रोकथाम में इसके प्रभाव पर डेटा एकत्रित करने के लिए एक आयुष संजीवनी नामक एक मोबाइल एप्लीकेशन जारी किया था। इस एप्लीकेशन के माध्यम से लगभग 3 महीने की अवधि में करीब 1,35 लाख से ज्यादा प्रविष्टियां यानी फीडबैक जो है संकलित किया हुआ है और इस अध्ययन में पाया गया है कि 85.1% लोगों द्वारा कोविड-19 की रोकथाम के लिए आयुष उपायों का उपयोग किया गया, जिनमें से 89.8% लोगों ने आयुष दिशा निर्देशों से लाभान्वित होने की सहमति व्यक्त की। Then research and development initiatives. इंटरडिसिप्लिनरी आयुष रिसर्च एंड डेवलपमेंट टास्क फोर्स। आयुष मंत्रालय ने एक इंटरडिसिप्लिनरी आयुष रिसर्च एंड डेवलपमेंट टास्क फोर्स का गठन किया गया है। इस टास्क फोर्स में देश के प्रमुख संस्थान जैसे आईसीएमआर, एम्स, डीबीटी, सीएसआईआर एवं आयुष संस्थानों के वैज्ञानिक सम्मिलित है। इस टास्क फोर्स ने कोविड-19 में प्रोफाइलैक्टिक एंड एड ऑन इंटरवेंशन स्टडीज से संबंधित क्लिनिकल रिसर्च हेतु प्रोटोकॉल को तैयार किया और आयुष सीएसआईआर की सहयोग के माध्यम से कोविड-19 में 4 आयुर्वेदिक औषधियों पर अनुसंधान अध्ययन किया गया। इनमें अश्वगंधा को रोग निरोधी के रूप में तथा यष्टिमधु गुडुचि और आयुष 64 का आधुनिक चिकित्सा औषधियों के साथ कोविड-19 चिकित्सा हेतु अध्ययन किया गया। Then research initiative taken by Ministry of Ayush. 4 types of studies has been taken: treatment studies, prophylactic, experimental, and retrospective observational study. Rationale for repurposing Ayush 64. तो Ayush 64 एक्चुअली CCRS द्वारा निर्मित प्रोडक्ट है जो 1980 में मलेरिया के लिए इसका उत्पादन किया हुआ था। आयुष 64 के क्वालिटी स्टैंडर्ड एस्टैब्लिश है, उस पे क्लिनिकल प्री क्लिनिकल स्टडीज हुई है, उसकी एंटीवायरल इम्यूनोमॉड्यूलेटरी एक्टिविटी एस्टैब्लिश है और मॉलिक्यूलर डॉकिंग स्टडीज भी इसकी एस्टैब्लिश है। इसके आधार पर इंटरडिसिप्लिनरी आयुष रिसर्च एंड डेवलपमेंट टास्क फोर्स के रिकमेंडेशन से इसको कोविड-19 की चिकित्सा हेतु इसका रिपर्पस किया हुआ है। इस पे अध्ययन हो चुका है आयुष 64 पे। आयुष सिस्टम वाइज कोविड-19 स्टडीज टोटल 139 स्टडीज कंडक्ट की हुई है मिनिस्ट्री ऑफ आयुष ने। उसमें से आयुर्वेदा की 70 स्टडीज है और उसमें प्रोफाइलैक्टिक कुछ स्टडीज है, कुछ ट्रीटमेंट स्टडीज है, कुछ ऑब्जर्वेशनल है, कुछ प्री क्लिनिकल है और कुछ सर्वे स्टडीज है। हमारे CCRS की टोटल 29 स्टडीज है आउट ऑफ 70। उसमें प्रोफाइलैक्टिक 14 है, थेरापेटिक इंटरवेंशन 10 स्टडीज है, ऑब्जर्वेशनल 2 है, सर्वे स्टडी 1 है, सिस्टमैटिक रिव्यू 1 है और प्री क्लिनिकल जो स्टडी है वो 1 है। Then research studies undertaken by CCRS. इसमें गुरुची घनवटी अश्वगंधा एंड सुदर्शन घनवटी पे स्कैरी सीडी न्यू दिल्ली में जो है ट्रायल हुआ है। ये कंटेनमेंट एरिया ऑफ दिल्ली में ये ट्रायल हो चुका था। गुरुची घनवटी और सुदर्शन घनवटी पे 16 CCRS के इंस्टीट्यूशन पे ये ट्रायल हुआ है और जो इसमें ये भी कंटेनमेंट जोन में हुआ है हेल्थ केयर वर्कर में। च्यवनप्राश में 2 ट्रायल हुए हैं, एक दिव्या कॉलेज में हुआ है ये जो सिंगल आर्म स्टडी था और चौधरी ब्रह्म प्रकाश में जो ट्रायल हुआ है वो रैंडमाइज कंट्रोल ट्रायल था। IU64 में दिव्या कॉलेज में जो ट्रायल हुआ है वो सिंगल आर्म स्टडी थी और चौधरी ब्रह्म प्रकाश में पायलट स्टडी हुई थी। IU64 में यहाँ GMC में ट्रायल हुआ था स्टेज 1 कोविड-19 पेशेंट पे, रैंडमाइज कंट्रोल ट्रायल था। चंडीगढ़ में ट्रायल जो हुआ है IU64 का ये एड-ऑन थेरेपी का ट्रायल है माइल्ड टू मॉडरेट केसेस में और IUCSR की सहयोग से 3 सेंटर पे एक ट्रायल हुआ था IU64 का जिसमें BMC कोविड केयर सेंटर बॉम्बे था, एक सेंटर दत्ता मेघ इंस्टीट्यूट ऑफ मेडिकल साइंस वर्धा था और एक सेंटर लखनऊ का किंग्स जॉर्ज मेडिकल यूनिवर्सिटी था। देन जैसे मैंने बताया कि संजीवनी ऐप द्वारा जो है इम्पैक्ट असेसमेंट हुआ है, ये एक ऐप बेस्ड स्टडी था और सभी स्टेट में ये स्टडी हुआ था। IU64 का इन सिलिको स्टडी हुआ है नेशनल इंस्टीट्यूट ऑफ न्यूट्रिशन हैदराबाद में। देन गुरुची घनवटी का भोपाल में ट्रायल हुआ है सिम्प्टोमेटिक एंड माइल्ड टू मॉडरेट केसेस में, रैंडमाइज कंट्रोल ट्रायल था। गुरुची पिंपली पे मेदांता हॉस्पिटल गुरुग्राम में ट्रायल हुआ है। देन च्यवनप्राश, संशमनी भट्टी और हरितकी का आयुर्वेदिक रक्षा किट का ये नॉन रैंडमाइज ट्रायल हुआ है। पुलिस पर्सनल में ये ट्रायल हुआ है निम्स हैदराबाद में और आयुर्वेद रक्षा किट 1 का जो ट्रायल हुआ है वो हेल्थ केयर वर्कर में हुआ है हैदराबाद में, जिसमें IU64 है, संशमनी भट्टी और च्यवनप्राश है। मंडी में जो ट्रायल हुआ है गुरुची घनवटी का ट्रायल हुआ है कंटेनमेंट एरिया में और अश्वगंधा टैबलेट और शुद्धि कैप्सूल पे ये ट्रायल हुआ है माइल्ड टू मॉडरेट केसेस में ये ट्रायल हुआ है, रैंडमाइज कंट्रोल ट्रायल था धमंतरी आयुर्वेदा कॉलेज चंडीगढ़ में। देन च्यवनप्राश पे ट्रायल हुआ है निम्स हैदराबाद में। हैदराबाद में 3 ट्रायल हुए हैं च्यवनप्राश, अश्वगंधा और गुरुची कैप्सूल का हेल्थ केयर वर्कर में और कंटेनमेंट जोन पॉपुलेशन पे ट्रायल हुआ है, तीनों प्रोफाइलैक्टिक ट्रायल थे। देन आयुरक्षा किट का ट्रायल हुआ है 20 CCRS इंस्टीट्यूट में अंडर SCSP प्रोजेक्ट जिसमें कंट्रोल पॉपुलेशन 22,000 थी और इंटरवेंशन ग्रुप में 1,78,000 पॉपुलेशन थी। अश्वगंधा पे एक रैंडमाइज कंट्रोल ट्रायल हुआ था जिसमें से एक सेंटर वर्धा में था और दूसरा कैरिक मुंबई और एक हसन में यह
संस्थान में किसी टेक्निकल इशू के वजह से अभी थोड़ी देर ये रुकी हुई है, लेकिन हम शॉर्ट ड्यूरेशन में उसको टैकल करके फिर से हम मीटिंग स्टार्ट करने वाले हैं या फिर से प्रेजेंटेशन स्टार्ट होगा।
sorry network issue was there. Yeah, रारी विजयवाड़ा एंड SV आयुर्वेदिक कॉलेज तिरुपति में एक डॉक्यूमेंटेशन हुआ है कि नेल्लोर डिस्ट्रिक्ट आंध्र प्रदेश में मीन्स वहाँ की लोकल हेल्थ पॉपुलेशन कोविड-19 मैनेजमेंट के लिए क्या यूज कर रही है उसका जो है डॉक्यूमेंटेशन स्टडी हुई है। देन IU64 पे सिस्टमैटिक रिव्यू हुआ है और अश्वगंधा पे एक अभी ट्रायल शुरू है जिसमें कोविड वैक्सीन के साथ अश्वगंधा की उपयुक्तता तथा सुरक्षितता का अध्ययन भी जो है अभी चल रहा है। यह जो स्टडी है देश के 7 शहरों में हो रही है, जैसे दिल्ली, मुंबई, पुणे, नागपुर, जयपुर, बेलगाम और हसन में यह जो है स्टडी हो रही है। देन च्यवनप्राश में एक ट्रायल शुरू है वर्धा में जिसमें अभी जो है ट्रायल मीन्स सैंपल साइज कंप्लीट हो गया है और फॉलोअप अभी शुरू है। देन प्रोफाइलेक्टिक स्टडीज इन कोविड-19, अश्वगंधा एज अ प्रोफाइलेक्टिक इंटरवेंशन इन हेल्थ केयर वर्कर। जैसे मैंने बताया था कि 3 सेंटर पे जो है अश्वगंधा का रैंडमाइज कंट्रोल ट्रायल हुआ था, जिसमें HCQ को कंट्रोल ग्रुप में लिया था। उस अध्ययन में हमें पाया गया कि जो अश्वगंधा आर्म वाले ग्रुप में एंजाइटी और स्ट्रेस का काफी इंप्रूवमेंट मिला है, और अश्वगंधा का जो हमें सेफ्टी प्रोफाइल भी एस्टेब्लिश हुआ है। देन च्यवनप्राश पे टिबिया कॉलेज में सिंगल आर्म स्टडी हुई थी, जिसमें प्रोटेक्शन रेट 98.91% था, और उसमें जो इन्फ्लामेटरी मार्कर्स है IL-6 और IL-10 में काफी जो है इंप्रूवमेंट मिला है। देन आयुर्वेदिक इंटरवेंशन आयुर्वेद रक्षा किट में भी जो है 20 पेरिफेरल CCRS के इंस्टीट्यूट में यह ट्रायल हो चुका है, जिसमें हमें यह मिला है कि जो आयुर्वेदा इंटरवेंशन ग्रुप में कोविड-19 सिम्टम का जो है इंसिडेंस कम मिला है। देन आयुर्रक्षा किट का दिल्ली पुलिस पर्सनल में ये एक्सप्लोरेटरी ट्रायल हुआ है, जिसमें हमने संशमनी वटी, आयुष काढ़ा और अनुतेल नस्य दिया था। उसमें हमें 90% कंप्लायंस हमें मिला है, और इंसिडेंस और मोर्टेलिटी रेट जो है वो दिल्ली पुलिस पर्सनल में काफी कम था एज कम्पेयर टू जनरल पब्लिक ऑफ दिल्ली। देन गुडची घनावटी, सुदर्शन घनावटी और अश्वगंधा टैबलेट पे एक ट्रायल हुआ है कंटेनमेंट 6 आइडेंटिफाइड कंटेनमेंट जोन ऑफ दिल्ली में। उसमें भी जो है इंसिडेंट जो रेट था वो कम था एज कम्पेयर टू कंट्रोल ग्रुप, और जो जनरल वेल्थ बीइंग में भी काफी अच्छा इंप्रूवमेंट मिला है। गुडची घनावटी पे राजस्थान में 6 कंटेनमेंट जोन में एक ट्रायल हुआ है, जिसमें कोविड-19 का हमें लोअर इंसिडेंस मिला गुडची घनावटी वाले ग्रुप में, और नॉन कोविड इलनेस का एपिसोड भी है वो काफी कम था उस ग्रुप में। कंटेनमेंट जोन में हैदराबाद में एक ट्रायल हुआ है गुडुची पे, जिसमें प्रोटेक्शन रेट ट्रायल ग्रुप में 100% था, और इन्फेक्शन रेट जो है वो नील था ट्रायल ग्रुप में, जो कि कंट्रोल ग्रुप में इन्फेक्शन रेट 1.1% था। हैदराबाद में एक आयुर्वेदिक रक्षा किट का ट्रायल हुआ है, जिसमें च्यवनप्राश, संशमनी वटी तथा हरित की हमने दिया था इन कोलैबोरेशन विद तेलंगाना स्टेट गवर्नमेंट। उसमें जो है हमें आउटकम ये मिला है कि 2 पार्टिसिपेंट कोविड-19 पॉजिटिव हुए हैं ट्रायल ग्रुप में, बट कंट्रोल ग्रुप में 15 जो है पॉजिटिव केसेस हुए थे आफ्टर 45th डे ऑफ द फॉलोअप, यानी इन्फेक्शन रेट कंट्रोल ग्रुप में 2% था और ट्रायल ग्रुप में 0.26% था। देन हैदराबाद में जो है एक फिर से ट्रायल हुआ है अमंग हेल्थ केयर पर्सनल आयुर्वेदिक रक्षा किट का, जिसमें IU-64 है, गुडुची घनावटी और च्यवनप्राश है। इसमें कोई भी जो है केसेस कोविड-19 पॉजिटिव नहीं हुआ ट्रायल ग्रुप में, हालांकि कंट्रोल ग्रुप में 5 पॉजिटिव केसेस हुए हैं आफ्टर 45th डे ऑफ द फॉलो। देन मेघालय में एक ट्रायल हुआ है ASA 20 का, जिसमें आयुष कौत है, संशमनी वटी और अनुतेल है। इसमें भी जो है ASA वाले ग्रुप में कोविड-19 का इंसिडेंस कम मिला है, और बेटर इम्यून स्टेटस स्कोर भी हमें आयुर्वेदा इंटरवेंशन के ग्रुप में मिला है। देन ट्रीटमेंट स्टडीज, कोविड IU-64 की जो कोविड आयुष CSR की कोलैबोरेटिव जो स्टडी थी, उसमें IU-64 को एड ऑन थेरेपी के रूप में दिया था, और 12 वीक ये स्टडी चली थी। उसमें IU-64 वाले ग्रुप में जो पेशेंट है वो जल्दी रिकवर हुए, और कोई भी हमें ऐसे सीरियस एडवर्स इवेंट रिपोर्ट नहीं हुआ, और RT-PCR निगेटिव होने का जो टाइम था वो भी कम था एड ऑन वाले ग्रुप में। गवर्नमेंट आयुर्वेदिक कॉलेज में नागपुर में हमने जो ट्रायल किया था IU-64 का, जिसमें IU-64 को एड ऑन थेरेपी के रूप में लिया था, और 1 मंथ का ये ट्रायल था। उसमें भी जो है क्लिनिकल रिकवरी IU-64 वाले ग्रुप में काफी अच्छी हुई है, और जो इंफ्लामेटरी मार्कर है IL-6, डी डाइमर, TNF अल्फा, उसकी लेवल भी काफी कम हो गई थी IU-64 वाले ग्रुप में। देन धन्वंतरी आयुर्वेदिक कॉलेज चंडीगढ़ में IU-64 का ट्रायल हुआ था। उसमें भी जो है RT-PCR निगेटिव होने का टाइम कम था IU-64 ग्रुप में, और HRCT जो चेस्ट HRCT है उसमें भी काफी इंप्रूवमेंट था। प्रो इन्फ्लामेटरी मार्कर्स है उसकी भी लेवल जो है रिड्यूस हुई थी। देन वेदांता हॉस्पिटल गुरुग्राम में रैंडमाइज कंट्रोल ट्रायल हुआ था गुडुची पिंपली का। गुडुची पिंपली को स्टैंडर्ड ऑफ केयर के साथ दिया था एड ऑन थेरेपी के रूप में। उसमें भी जो है कोई भी पेशेंट जो है क्रिटिकल स्टेज में नहीं गया, और सभी पेशेंट जो है 6 डे तक जो है असिम्प्टोमेटिक हुए, बट कंट्रोल ग्रुप में ओनली 40% ही जो पेशेंट है वो असिम्प्टोमेटिक हुए हैं, और हॉस्पिटल स्टे का जो ड्यूरेशन है वो भी कम था आयुर्वेदा एड ऑन ग्रुप में, और कोई भी ऐसे ड्रग हब इंटरेक्शन नहीं रिपोर्ट हुआ है। देन भोपाल आयुर्वेदिक कॉलेज है, उसमें गुरुची घनवटी का ट्रायल हुआ था, उसमें भी जो है आरटीपीसीआर नेगेटिव होने का टाइम जो है वो कम था। अर्लियर क्लिनिकल रिकवरी हमें मिली है गुरुची घनवटी ग्रुप में, और कोई ऐसे एडवर्स ड्रग रिएक्शन नहीं रिपोर्ट हुआ। चंडीगढ़ में ही अश्वगंधा टैबलेट और शुद्धि कैप्सूल का ट्रायल हुआ था, उसमें भी हमें जो है क्लिनिकल इंप्रूवमेंट मिला है आयुर्वेदिक ग्रुप में, और आरटीपीसीआर नेगेटिव होने का टाइम भी इसमें कम था। एक अहमदाबाद में एक स्टडी हुआ है जिसमें हमने कन्वेंशनल केयर के साथ दशमूल पथ्यादि क्वाथ त्रिकटु संशमनी वटी और आयुष 64 टैबलेट तथा यष्टि मधु घनवटी दी थी। उसमें असिम्टोमेटिक जो कोविड-19 पेशेंट थे उनमें कोई भी कोविड-19 के सिम्टम नहीं आए। जो सिम्टोमेटिक कोविड-19 पेशेंट थे उसमें अर्ली रिकवरी हुई, और जो क्रिटिकल स्टेज वाले पेशेंट थे उसमें कोई भी जो हमें मोर्टेलिटी का इवेंट नहीं मिला, और कोई भी पेशेंट प्रोग्रेस नहीं हुआ। एम्स जोधपुर में आयु 64 का एड ऑन थेरेपी के रूप में ट्रायल हुआ है स्टेज 1 पेशेंट पे, उसमें भी जो है हमें क्लिनिकल रिकवरी अच्छी है पेशेंट की आयुर्वेदा ग्रुप में, और आरटीपीसीआर नेगेटिव होने का टाइम भी जो है कम था। पायलट स्टडी हुई थी चौधरी ब्रह्मा प्रकाश दिल्ली में आयु 64 में, उसमें जो है क्लिनिकल रिकवरी आफ्टर 14 डेज जो है काफी अच्छी थी। 18.6% पार्टिसिपेंट ने क्लिनिकल रिकवरी शो की थी। देन उसमें भी है आरटीपीसीआर नेगेटिव होने का जो टाइम था वो कम था, और कोई भी साइड इफेक्ट हमें नहीं मिला है। तिबिया कॉलेज में आयु 64 का ट्रायल हुआ था असिम्टोमेटिक एंड माइल्ड टू मॉडरेट केसेस में, उसमें भी हमें सेम आउटकम मिला है। और अभी पोस्ट कोविड का एक हमें ट्रायल हो चुका है और अभी ऑनगोइंग भी है, जो गवर्नमेंट आयुर्वेदिक कॉलेज नागपुर, जैन मेडिकल कॉलेज और वर्धा में ट्रायल जो है हो चुका था, जिसमें अगस्त्य हरितकी और अश्वगंधा और योगा ये प्रोटोकॉल था। उसका ये स्टडी कंप्लीटेड है, बट उसका जो एनालिसिस इन प्रोसेस है। और जो डॉक्यूमेंटरी स्टडी बताई थी थ्रू संजीवनी मोबाइल ऐप, जिसमें आयु 64 और कबासुर कुटीनेर पाथ हमने असिम्टोमेटिक एंड माइल्ड टू मॉडरेट केसेस में दिया था, तो उसमें 96,000 सब्जेक्ट एनरोल हुए थे। डाटा हमने आयुष संजीवनी मोबाइल ऐप के थ्रू डॉक्यूमेंट किया है। स्टडी कंप्लीटेड है, बट एनालिसिस उसका अंडर प्रोसेस है। प्री क्लिनिकल स्टडीज आयु 64 का इन सिलिको इन सिलिको स्टडी हुआ था आयु 64 में आईसीएमआर नेशनल इंस्टीट्यूट ऑफ न्यूट्रिशन हैदराबाद में। उसमें जो है आयु 64 के जो डिफरेंट कंपाउंड्स थे उसको इसका इवैल्यूएशन हुआ है अगेंस्ट सार्स कोविड वायरस 2। उनके जो मेन प्रोटीएस टारगेट था उसका जो है इवैल्यूएशन हुआ है वाया कंप्यूटेशनल मॉलिक्यूलर डॉकिंग। उसमें जो है रिजल्ट हमें ये मिला है कि आयु 64 इज ऑलरेडी मार्केटेड एंड सेफ ड्रग and it's a maybe a good candidate for the repurposing against COVID-19. TBT आयुष नेटवर्क TBT आयुष नेटवर्क प्रोजेक्ट है COVID-19 पे। इसमें अश्वगंधा गुडुची पिंपली यष्टि मधु तथा आयुष 64 का हर्बल एक्सट्रैक्ट लिया था, कुछ नेजल फॉर्मुलेशन लिए थे। इसमें प्री क्लिनिकल फार्माकोकाइनेटिक और उसकी इम्यूनोमॉड्यूलेटरी एंटीवायरल एक्टिविटी, प्री क्लिनिकल स्टडी तथा फार्मेकोलॉजिकल और टॉक्सिकोलॉजिकल स्टडीज हुई थी। फार्मेकोकाइनेटिक स्टडीज हुई थी इन विट्रो, और उसमें ऑल द हर्बल एक्सट्रैक्ट शोड द इफेक्ट अगेंस्ट कोविड वायरस इन्फेक्शन एंड अनुतेल शोड द बेटर रिजल्ट इन कॉम्बैटिंग द इफेक्ट ऑफ सार्स कोविड वायरस इन्फेक्शन। इन सिलिको स्टडी हुआ था आईआईटी वाराणसी बीएचयू में, जिसमें मेन प्रोटीएस एंड आरएनए डिपेंडेंट आरएनए पॉलीमरेज ये दो पोटेंशियल टारगेट हमने लिए थे सार्स कोविड वायरस 2 के फॉर स्क्रीनिंग द हर्बल कंपाउंड, and the study outcome showed the beta sitosterol, a compound of the Ayushkat, is a common and potential inhibitor of the M protease and RNA dependent RNA polymerase. Then dissemination of the outcome of the research study. जैसे कि मैंने आपको पहले ही बताया था कि मिनिस्ट्री ऑफ आयुष ने जो रिसर्च स्टडी कंडक्ट की थी उसका डिसेमिनेट किया है रिसर्च आउटकम को इन द फॉर्म ऑफ द पब्लिकेशन। तो उसके लिए एक एडवाइजरी पैनल कंस्टिट्यूट किया था टू फैसिलिटेट द आयुष रिसर्चर in disseminating the outcome of the research studies on COVID-19 through scientific publication in the journal of the high repute. उसमें 86 मैन्युस्क्रिप्ट ड्राफ्ट हुए थे, 30 मैन्युस्क्रिप्ट पब्लिश्ड है और 27 प्रीप्रिंट्स जो है अवेलेबल है। जो पब्लिश्ड आर्टिकल है आपको कोविड जो है कोविड जो आयुष रिसर्च पोर्टल है उसमें अवेलेबल है। मिनिस्ट्री ऑफ आयुष ने एक नेशनल क्लिनिकल मैनेजमेंट प्रोटोकॉल भी पब्लिश किया है। यह जो प्रोटोकॉल है इस फॉर प्रोफाइलैक्सिस मैनेजमेंट ऑफ असिम्प्टोमेटिक एंड माइल्ड कोविड-19 केसेस एंड पोस्ट कोविड केयर के लिए प्रोटोकॉल है। और अदर रिसर्च एंड डेवलपमेंट इनिशिएटिव्स में एक रिसर्च स्टडी इनिशिएट की है, assessment of integration of Ayush into public health system for combating COVID-19 in collaboration with PHFI। और जैसे मैंने बताया कि अश्वगंधा का यह ट्रायल अभी शुरू है, जो कोविड वैक्सीन के साथ जो है अश्वगंधा की उपयुक्तता तथा सुरक्षितता का अध्ययन शुरू है 6 जगह पे। देन इंटरडिसिप्लिनरी टेक्निकल रिव्यू कमिटी जो है कॉन्स्टिट्यूट की है मिनिस्ट्री ऑफ आयुष ने फॉर एग्जामिनेशन ऑफ द एप्लीकेशन और क्लेम्स ऑन पेटेंट एंड प्रोप्रिएटरी एंड क्लासिकल Ayurveda, Siddha, Unani and homeopathy medicine with new indication or repurposing for COVID-19। यह जो इंफॉर्मेशन है ये सारी जो है आपको मिनिस्ट्री ऑफ आयुष की वेबसाइट पे अवेलेबल है। उसमें आयुष कोविड-19 डैशबोर्ड है जिसमें यह इंफॉर्मेशन अवेलेबल है। और अगर आपको नेशनल मीन्स कोविड-19 रिलेटेड पब्लिश्ड आर्टिकल और प्रीप्रिंट अगर उससे इंफॉर्मेशन चाहिए उससे रिलेटेड, तो वो भी जो है आयुष रिसर्च पोर्टल वेबसाइट पे अवेलेबल है। Now, I am confident that all of you become aware about the initiatives taken by the Ministry of Ayush, and आप सभी लोगों ने इतना पेशेंसली यह प्रेजेंटेशन सुना, इसलिए आप सभी लोगों का धन्यवाद। Thank you for your kind attention. Now I hand over the session to Dr. Vanmala ma'am.
Thank you so much for presentation. Now I request to Dr. Suryanshi sir. Please.
Thank you very much, Dr. Vanmala ji. Dr. Anand ji, Dr. Anand More ji, Professor Anand More, Dr. Manisha ji, इनको आपने अभी सुना है और बहुत अच्छे से आपको ज्ञान प्राप्त हुआ होगा ऐसा मैं उम्मीद रखता हूं, और आपके जितनी भी शंकाएं होंगी उनका निरसन भी हुआ होगा ऐसा मैं मानता हूं। ये हमारा एक प्रयास था कि हम जन जन तक पहुंच सके कि मिनिस्ट्री ऑफ आयुष ने इस कोविड काल में या पैंडेमिक सिचुएशन में क्या क्या स्टेप लिए हैं और उसका क्या क्या इम्पैक्ट सोसाइटी पर हुआ है, इस बारे में जो भी जानकारी देने का प्रयास कर रहे हैं। अभी भी हमारा प्रयास जारी है, हम सभी जगह पे मतलब जहां हम पहुंच सकते हैं, यहाँ तक कि हम गढ़चिरौली तक पहुंच चुके हैं और वहां पर जन तक आयुष रक्षा किट का वितरण, निःशुल्क वितरण कर रहे हैं। आईसी के माध्यम से लोगों को जागरूकता फैला रहे और इसी के संदर्भ में संसमनी वटी और अश्वगंधा वटी का निःशुल्क वितरण भी हमारे द्वारा हो रहा है। तो मैं समझता हूं कि हमारा जो प्रयास है इसमें हम लोग सफल होते आ रहे हैं ऐसा मुझे लग रहा है। और इसी विश्वास के साथ मैं आज जो हमारे स्पीकर हैं उनका धन्यवाद देता हूं, उनको जो हमारी हौसला बढ़ाते हैं, आदरणीय महानिदेशक महोदय, आयुष मंत्रालय, और इनके माध्यम से जो भी हमारे कार्य करते हैं और हम कार्य करने का प्रयास कर रहे हैं, इनके माध्यम से जो भी हमको स्फूर्ति मिलती है या जो भी प्रयास करने में सफलता मिलती है, उनके लिए मैं बहुत बहुत धन्यवाद हूँ। आदरणीय महानिदेशक महोदय का, आज के स्पीकर का, आप सभी प्रतिभागियों का मैं सादर और साधुवाद देता हूँ आपको। इसी के साथ मैं चाहता हूँ कि डॉक्टर वनमाला जी आगे आपको आगे की गतिविधि आप
Thank you so much, sir. I express gratitude to in charge of institute, Dr. Suryanshi sir, for motivate, guide, and support of this webinar. I also thankful to our special guest, Dr. Anand More sir, for excellent presentation on overview of COVID. I have shown appreciation to Dr. Manisha Talekar for elaboration of prophylaxis and management of COVID-19 through Ayurveda by Ministry of Ayush. Thank you so much all participants for listening to us and most importantly for giving us your precious time. Thank you Dr. Shekhar Namburi sir, Dr. Priya Thakre madam, Dr. Prashant Shinde sir and all staff member who made this all possible. Thank you all once again. and webinar certificate will be sent on your email within 7 days. Thank you so much.